When I became a physician, I took an oath. I took an oath to take care of my kids, to stand up, to be their protector, to be their healer. So Flint was an almost bankrupt city, and in 2011 lost control of the city's finances. And it was decided that the water that we had been getting from Detroit for half a century, pre-treated Great Lakes water, was too expensive, and that we would start drawing water from the local Flint River. You know, when I heard about the possibility of lead in the water, I decided to see if that lead in the water was getting to the bodies of my kids, the kids that I take care of in clinic. We noticed that after the water had switched, the percentage of kids with elevated lead levels actually increased. Population-wide exposure to a potent, irreversible neurotoxin. My focus and my commitment shifted to the tomorrows of our children. A child is never supposed to be exposed to lead. It impacts a child's cognition, how kids think. It actually drops their IQ levels. It impacts a child's behavior, how they act, and leads to things like attention deficit disorder. It also impacts a child's impulses, causes things like impulse disorder, conduct disorder. It's even been linked to violent crime and criminality. It affects a child's entire life course trajectory. So we held a press conference to share these research findings. And right after that is when I was attacked by the state. My science was attacked, my credibility was attacked. But we fought back. We fought back with the science, with the data. The numbers didn't lie. But more importantly, the numbers of my research weren't just numbers, they were kids. You don't mess around with kids. You don't mess around with lead. So finally, our evidence spoke truth to power. And within a few weeks, the state did admit that there was a problem, and we switched back to treated water. So I currently direct this amazing program. It's called the Michigan State University Hurley Children's Hospital Pediatric Public Health Initiative. Children in Flint have, previous to the water crisis, a 15-year less life expectancy than children in a neighboring zip code. Flint was already suffering from significant disparities. The water crisis is an added disparity, an added adversity, an added toxic stress. So what we are putting in place is the treatment for all of this adversity. It is investing in public health. It is investing in the wraparound support programs that are evidence-based, that science has taught us improve children's health and development. You can often think of it like a giant hug. We are hugging these children with everything. Right here in our clinic, every kid that comes in gets a nutrition prescription. Just like a prescription for amoxicillin, we give them a prescription for healthy living, where they can fill right downstairs in our farmers market. We've expanded breastfeeding services. We have mobile grocery stores. A lot of our efforts are on early education, high quality childcare, things like Head Start and literacy programs all benefit children's development. So we're bringing in these evidence-based interventions to Flint, and we're bringing in as many as we can for our children. We hope to share really with the world in 5, 10, 15 years that, yeah, Flint had this disaster, yet we were proactive and we were positive and we intervened. And because of what we did, this is what you can do in your community. Because by and large, there are Flints everywhere. Yet that doesn't have to be the case. So we are hoping to really share this blueprint of what we were able to do for our children, for children all over the country.